Hello and welcome to WHO's headquarters in Geneva, Switzerland. I'm Vismita Gupta-Smith and we are talking today about WHO's 75th anniversary. WHO will observe its 75th anniversary on 7th of April. What does that mean for the world? What does that mean for WHO? And most importantly, what does that mean for you? Ask us your questions, tell us what health means to you, and how do you look at health in the future? Hashtag it for us, hashtag AskWHO. And before we go ahead and take your questions, and while you get your questions on our timelines, let me introduce you to our guests. We have experts in our studio today, Dr. Ruediger Krech. Welcome, Ruediger. And joining us from New Delhi, India, is Dr. Sanjoy Bhattacharya. Dr. Bhattacharya is a public health historian who works for University of Leeds. Hello, Sanjoy. So we are going to get started. As you get your questions together, I'm going to pose some questions to our experts first. WHO is turning 75 at a time when the world is at the confluence of several crises, from climate change to an energy crisis to geopolitical crises as well. And of course, we are in the midst of a pandemic, and there's a health crisis going on. What does this mean for the world? And these crises have also created a lot of insecurity among countries, among institutions, and individuals. So let me pose my first question to you, Ruediger. Talk to us about these insecurities and what that means for the world and especially for our audiences and individuals.
Well, first of all, many of us are stressed, right? So something has happened perhaps far away from myself, and that has had impact on my personal life. Each of our lives, not only some aspects, but all aspects of our lives. Then we see the consequences of climate change, not in theory, but in real practice. We see the hate and the mistrust in the net. We see that people are in their own bubbles more and more. We are seeing even wars in Europe. I mean, there's been many wars all over the time since WHO started, but to have a war in the midst of Europe has been quite unpredictable for many of us. Now, that creates this insecurity, Vismita, and it actually compromises our ability to take control over our health and lives. And that's what health promotion is all about, to take control over our health and lives. And so health is actually a very good compass, in fact. And we now see with the COVID crisis what happens if health is not at the table of decision-making. We see it with the many deaths, the huge suffering all over the world, and the economic costs of 9 trillion counting. And so therefore, at WHO, we've been calling for health in all policies for many years. And what does that mean? It means that we're looking at the health impacts of so different policies, such as transport policies. So it has a huge health impact what sort of transport policy you choose for your own country. Or finance policies. What are your financial measures that you put in place in terms of taxes, of subsidies, of investments, has a lot to do with health. And of course, education is intrinsically linked to health as well. So, and we all know now that we cannot just go back to the life of before. We need to change our behaviors. I think that's very clear to all of us. We need to adapt our own behaviors. So first of all, that we're really looking, each of us, that when we talk, we base it on evidence, that we talk the truth and not some opinions which are totally ungrounded in evidence. And we know also that our behavior and environmental pollution needs to be adapted so that we create societies which are prosperous, but within the boundaries of our planet. We've learned that now, and we can, of course, also make use of the steady advancements in technology. So there's helpers for us also to create those well-being societies. So that's, I think, where the world stands at the moment.
So Ruediger, we'll talk a little more about how we as individuals can take control, take charge of our own health. But as you mentioned, now the world has seen that when health is at risk, everything is at risk. I want to come to you, Sanjoy, and ask you, excuse me, so WHO was formed in the wake of World War II, with utter destruction around us and with a very lofty, very high goal to achieve. Talk to us about what were the thoughts of the founding countries and what does that mean for the world today?
Thank you, Smita, for inviting me.
But they had different methods for doing it.
So Ruediger
He brought
spoke right now
class.
powerfully about the period of stress. So WHO was conceptualized as the World War was ending, the Second World War was ending, which was another period of stress. Millions had died on the battlefields. Others had, many millions had become disabled. Hiroshima and Nagasaki happened. People realized the power of new weapons of mass destruction. It was clear that new political stresses were coming up between, Eastern Europe and Western Europe, and both sides were in a race for these atomic weapons whose destructive power had become very clear in the war in the Pacific. So all this stress in 1945 resulted in discussions amongst people who wanted peace. And peace was seen as an immense determinant of health, correctly so. But what made the WHO extraordinary, as the idea of the WHO was discussed, was that freedom movements, because it was clear that the world, large parts of the world were going to decolonize, empires were going to break down, and the new political forces that started talking about the WHO basically involved freedom movements and nationalist movements. So it was extraordinary. The world had never seen something like this, just so that people on different sides of political boundaries could talk to each other about health, about complex social and cultural determinants of health, how to resettle millions of refugees, how to rebuild housing, how to rebuild healthcare facilities, which had all been destroyed by this global war. So in this scenario, what was coming up was extraordinary. The WHO was the beacon of hope for all the people who were involved in the prolonged and complex discussions that led to the foundation of the WHO. It started in 1945, and the WHO was formed, as we are celebrating, in 1948.
Often about WHO as a democratic force. So I'm going to throw that back at you, and if you could elaborate on that before we take some audience questions.
So for me, the WHO is extraordinary because it is a democratic force in the sense that it is empowering newly decolonized countries, ex-imperial possessions like British India, which are breaking into countries like Pakistan and India, British Ceylon, which becomes independent Ceylon, now Sri Lanka, and colonial British Burma, which then is now Myanmar. As all these countries decolonize and form, the WHO is actually giving them a platform. And what often people forget is how extraordinary this democratic process was, in the sense a country as big and as powerful as the USA would have one vote in the World Health Assembly, as would a tiny country in Africa like Liberia, which was also playing a very important role in the discussions about what the WHO should be and could be in terms of inclusion and diversity. So for me, as someone of South Asian heritage, who now lives and works in the United Kingdom, it is very obvious to me that this was an extraordinary organization that was saying all lives matter. That's why we want to listen to all voices. And we're going to create structures around the world where African and Asian voices are given the same importance as North American and European voices. So as a historian of medicine, this was just something incredibly democratic. It was setting new standards of democracy and health that had never been seen before. So for me, yes, the WHO was a force for democracy then, and I continue to have time for it today, which is why I'm giving you my time today, because I think it remains a very important force for democracy today too.
Well, we're always happy to have your time, Sanjoy, as someone who has been part of WHO, and you're now, as a public health historian, we hear from you so many things that sometimes we may not know about. So always appreciate that. I'm going to come to you, Ruediger, but and I want you to talk to us about what health for all means in this scenario. But before that, let me take a couple of audience questions which are related to what does health for all mean. On LinkedIn, Dr. Harivansh Chopra is saying that health is multidisciplinary and multidimensional. Why all the development partners are not on a common platform working together in every country? And then on LinkedIn, also Stanley Sunjo is asking, to what extent is WHO prioritizing health promotion and community engagement interventions, considering the importance of these in averting major global outbreaks like COVID? So over to you.
Yeah. Thank you very much, and thank you, colleagues, really for your questions here. So first of all, health for all means health for all and not health for some, which a lot of member states still think. So it means, first of all, that everyone receives health services he or she needs whenever he or she needs it. So receives that whenever he or she needs it, wherever they are, and of good quality, and without falling into financial hardship. So it's actually quite clear, and it sounds so easy. But then it is a little bit more complex, because that also means that we need to have the health personnel available at all times, also well educated. It means that we are very clear what health services are in terms of how we ensure services between ambulant and outpatient services. It means that we're having good prepayment financial mechanisms so that you don't pay out of your pocket when you're getting sick. And it also means that it's not just curative care, but it's also a lot of health promotion and disease prevention mechanisms that we need to have in place. It's all based on primary health care. That's also clear. You cannot have specialized care at the start of the horizon of healthcare, but you need to first base that on primary healthcare mechanisms. And that's also something that we're working with a lot of member states on to make that more interesting, to incentivize it more so that it's also better used. Then health for all also means that you have social protection mechanisms in place. So a protection against the major risks, and that's why we're working with our sister agencies, for instance, in the ILO, and also, of course, in the World Bank and in OECD and other organizations, to make sure that those social protection mechanisms are part of also that health is also part of those social protection mechanisms. And then, of course, you need to create an economy that is making it hard to actually produce health-harming products, like tobacco or alcohol, sugar, sweetened beverages, or food that is full of fat and salt. So we also need to look at what needs to be done to prevent especially chronic diseases like cardiovascular diseases, cancer, respiratory diseases and the like. So what I'm describing here are not woolly ideas. Everything that I said has been proven, has been shown in practice that it works. But what you need is political will. And that is something that, Sanjay was talking about WHO as really somebody who convenes that and, those different stakeholders. That's exactly it. Because we are gathering the evidence. We're analyzing what works and what doesn't. We're assessing the different policy options that a country has in our country offices. And then we want to work with countries to actually, to choose and implement the choice they made. And so again, it's not woolly, it's on the contrary, it's very concrete what countries can do to actually implement health for all and create these well-being societies that I was talking about earlier.
So, Ruediger, the future that you're describing for health for all would be one where we all are breathing clean air, eating clean food, drinking clean water, where we are taking, the environment is protected and therefore our health is protected, and we have health systems that don't make us poor when we have a catastrophic illness. This already sounds like this is not the world we're living in right now. Even in well-resourced settings, we don't have this. This is not a reality. So let me, and it does sound almost like, how will we get there? This sounds like a difficult target to reach, but like you said, there is a lot of evidence. This has been done in many parts of the world. The challenge is how to make it available for everyone, right? Health for all. So let me come to you, Sanjoy. In our 75-year history, the world has come together many times to achieve really difficult targets and what looked like impossible targets. Speak to us about that, please.
Tasks.
So to follow on from what Ruediger just said, universal healthcare, primary healthcare, is intended to ensure that at a basic level, everyone gets quality and safe healthcare. And the WHO helped promote that around the world, whether it was in a high-income country setting or a low and middle-income country setting, or, often in decolonizing countries, there were big gaps in healthcare provision, which the WHO regional offices would go in and help plug those gaps. So Ruediger was making a very important point. There are many types of technology, very important basic technology like vaccines and vaccination, basic technology like water testing kits to make sure that water isn't infected with diseases like cholera, for instance. And then you have very expensive technology that you see in super specialized hospitals. And it's impossible to provide super specialized hospitals in every district and every village in a country, for instance. So therefore, preventive medicine is very important. And you see that from its very inception, what the WHO is trying to do is mobilize large numbers of efficacious vaccines, safe vaccines, basic medicines like antibiotics that were needed to kill the bacteria that were, driving up infant mortality, for instance, in Asia and Africa too. So, in a responsible way, it would also provide guidelines about how to use, not to overuse antibiotics. The fact that in some contexts this was ignored is a different matter. So in this role, what the WHO could do as a promoter of immunization and quality preventive health, as a historian, what has always struck me that right from its inception, the WHO is able to go into peacemaking mode in conflict zones and say, okay, can the different parties stop fighting? And you would have ceasefire immunization campaigns where wars, battles would be stopped. So immunization could take place so that, infectious disease spread could be stopped. It was staggering. I'm a historian of smallpox eradication. I would argue that, a lot of institutions around the world have claimed credit for successful smallpox eradication. I would argue that smallpox eradication was impossible, would have been impossible if the WHO hadn't got involved. Because the WHO was the force that could get different political interests around the table to talk to each other, to mobilize financial aid, to mobilize vaccine aid, to make sure that those vaccines could be redistributed across political barriers. Smallpox, a disease that killed millions once upon a time, was eradicated. That is, naturally occurring smallpox doesn't exist today because of the political goodwill and that democratic force that I spoke about earlier, that the WHO was able to create in the field of international health. So for me, perhaps the humanities and certainly the WHO's greatest achievement is the eradication of smallpox. Some people say, oh, it wasn't a big problem in Europe, so it wasn't a big problem. But it was a big problem in low and middle income countries because it was killing millions in cycles, and often it hit people who were the poorest because they were living in extremely crowded conditions. So smallpox eradication was certainly a big thing across Asia and Africa, and especially in populations that were more sort of affected by the risk of smallpox infection by smallpox. Then, of course, smallpox eradication happens, but even as smallpox eradication is being certified, that is investigated independently and then certified by a high-level committee, because, the WHO was sensible enough to know that it couldn't certify its own work. So it got together a group of independent scientists who looked at the evidence and said, yes, the world is free of smallpox. Even as this is happening, what does the smallpox eradication program do? It creates the expanded program on immunization. So the WHO then creates a mechanism through which countries that do not produce safe vaccine get access to the vaccines against diseases that impact different countries that are members of the WHO. And this is where the regional offices play a very important part too, because they identify what diseases are causing problems in different countries in each region. The WHO then organizes supplies of vaccine and makes sure that these vaccines then get to these countries. Now, if the WHO had been a political organization, then it would have been impossible. But the WHO tries always, historically, to remain neutral. It tries to keep lines of communication open with all sides, simply so that it can get health information from all sides. It can get epidemiological information about how diseases are spreading from all sides. It makes sure that one country that has less vaccine gets more vaccine from the country which has surplus vaccine. It makes sure that people are getting good sort of, guidance about how to use vaccines. If people have to be revaccinated, it's absolutely normal in some diseases for someone needing revaccination. This idea that you just vaccinate someone once and, job over, that was never the case. Revaccination is also important. And just as, the WHO plays an important part in vaccination programs, we mustn't forget the important roles the WHO plays in frequent revaccination programs. And then, as Ruediger mentioned, health is much more than just infectious disease. This is where you then see WHO playing leadership roles in other things. For me, one of the most striking episodes is the Framework Convention against Tobacco Control. Small low-income countries couldn't take a stand against big tobacco companies who were peddling cheap tobacco products to, their big populations, who were then suffering ill health, sometimes edible tobacco would create, huge incidents of mouth cancers, for instance, tongue cancers. Low and middle income countries were really struggling with a sort of health burden from tobacco usage. It was the WHO that stepped up and said, okay, we are going to now create a stage where low-income countries and high-income countries who are interested in collaborating can come together. And they did come together. And again, I mentioned that in 1948, WHO created a democratic space. When the FCTC negotiations were taking place, again, a democratic space was created where civil society organizations from the low and middle income countries and high income countries worked alongside interested governments, and many Asian and African governments came together to play a leadership role in isolating these big tobacco companies, which had big financial clout, which they would use for adverse advertising and things. And they were defeated. This convention was created, which now controls tobacco usage, how much it is used, how it is advertised. It has made a huge difference. And then, we can't forget other successes too. Polio eradication is not still a reality, but the point remains that in a complex country like India, with complex governance structures, polio has been declared eradicated. Yes, there are some wild polio viruses around, but naturally occurring polio has largely been eradicated. Now, Ruediger mentioned the importance of primary healthcare structures. Absolutely. What is the best way to make sure that we capitalize on these successes? By having strong primary healthcare structures, which can keep a lookout for disease, which can make sure that perhaps follow-up injectable polio vaccination can happen to keep, the polio status going. Because the thing about these elimination and eradication programs is you can never take your eye off the ball. You have to be always ready. And this I'll say for the WHO, despite being hit by almost daily demands about the various crises around the world, the WHO remains agile and responds. So, right from 1948 to, what we're going through right now, COVID, which was extraordinary because the world wasn't prepared for it, When SARS broke out, no one was able to come up with a vaccine as quickly as we've been able to for COVID. The WHO had a role to play in vaccine distribution, vaccine collection, and for that, I congratulate the WHO.
Sanjoy, actually on that, on science and technology, we have a question from Dr. Narasimha Murthy, and I'm going to pose it for you, Ruediger. WHO, you're doing a great job so far. Further journey calls for faster technology adoption. What's the future plan? I'm going to take a few more questions because I want to elaborate. I want you to elaborate on the role of WHO, especially now that the pandemic has unfolded in front of us, and a lot of demands on WHO as well, and a lot of eyes on WHO. So Esther Ajiboye has a question. What has the WHO been doing with regard to pandemic preparedness, as this is a big deal since COVID-19 and other diseases may have the potential to be a pandemic? Christiana Akinola also says, what are the active and practical implementations in place to ensure that health for all is indeed health for all? For instance, hoarding of vaccines, prioritization of the developed countries at the beginning of COVID-19 pandemic certainly negates this claim. Is health indeed for all? So speak to us about the role that WHO plays in bringing countries together on one platform.
Yeah, thank you very much. Indeed, COVID must be a wake-up call for all of us. It's not been the first one. We had H1N1, we had H5N1, we had Ebola, and then we had COVID, just in this very young millennium. And it shows very much that if you're not learning from one crisis, the next one will hit you harder. So if we're not learning from this, and thank you very much for those questions. So first of all, coming back to the first question on what sort of priority would health promotion need to have also in epidemic preparedness. Now, in health promotion, we're working with social engagement. So you're not designing something for somebody, but you're designing it with the population group at hand. Now, had we only done this during COVID, that, it's very clear that you cannot just rule through a nation from the national level right to the school, but you need to perhaps identify what are the main benchmarks of social distancing, of, hygiene, of airing the classrooms. And then you need to adapt it to the school environment locally. So co-design is one of the things. Then empowerment is the next one, which we work with. So to actually empower people to take control over their health and lives in this context means, of course, that we need to explain the evolving crisis. And that's been a real hard one, because people then always said, well, why are there always these changes in messages? And those changes in messaging was, of course, because we learned more about this crisis as we got to know it. Because, as Sanjoy said, we didn't know what COVID was and how it reacted. So we need to adapt public health messages to the evidence that we're collecting. And to make that transparent for people, that this is a journey where we learn together and that we also then have joint solutions adapted to the local context. I think that's something we all in public health need to learn very much. Now, what is happening on the preparedness side? And isn't that interesting? Because in WHO we have identified what we call disease X. So we know more or less which strains of viruses could create a next epidemic or pandemic. And we also know what are the fundamental risks that member states and partners now need to address in order to prevent a next epidemic or pandemic from happening. And honestly, colleagues, I'm a little bit. Normally, I'm very, very hopeful. Here, I'm a bit worried, and I'm a bit worried, Vismita, because people say that they are tired. They are tired of this pandemic. They have ended it on the 23rd of February 2022, when the Ukraine war has started, especially in Europe. And then they said it's over. But it's not over. It's only over if we've addressed fundamentally the risks that may lead to a next pandemic. And there's about 30 risks I could talk about that we urgently need to take urgent action on, because otherwise I'm not so hopeful that we will not see a next pandemic in our lifetimes.
So I want to interrupt you here, Ruediger, and also open it up with a question from
Sure.
our audience. We have a question from Promise Sefoga. Apologies for mispronouncing your name. And Promise's question is, on this occasion, on the 75th anniversary, is WHO considering redefining health? Before you answer that, Ruediger, let me come to you. Sanjoy, talk to us about how WHO, when it was founded, how the world defined health. It's a very forward-looking definition, and it's an all-encompassing definition that we still, to this day, find very, very relevant, right? Speak to us on that, and then I'll come to you, Ruediger.
So, before the Second World War broke out, the international organizations then were mostly worried about the global spread of infectious diseases. And why were they worried about global spread of infectious diseases? Because trade would get disrupted, profits would get disrupted. So that necessarily meant that the definition of health was very medicalized in one sense. It was about infectious disease. And because the goal was narrow, that is, make sure that, everyone's health is okay and disease is limited so that trade can flow and profits can be made. The goal was narrow, the impact was therefore also narrow. What the WHO starts doing from 1945, as it's being imagined, is what Ruediger said at the very beginning. The founders started talking about stress. The founders started talking about the psychological impact of war. The founders were saying, okay, a lot of people have died, but equal numbers of people have got injured and are disabled. How are we going to deal with them? People talked about, refugees. People talked about the horrific experience of the Holocaust and what that meant. There was a massive famine in colonial Eastern India, which had killed millions. The WHO's different founders from the different parts of the world, high-income country or decolonizing countries, were all asking questions about how can we make sure that all these diverse and disparate experiences and needs are catered for. That, for me, when I look at the unpublished files about the discussions that form the WHO, becomes center stage to the new expansive definition of health. That health is not just stopping infectious disease. That is important, but there are other things too. Mental health, peace, well-being, complete physical, holistic physical and mental well-being. The idea of well-being that, we must look at hunger. We must not let someone be hungry just because they don't have an infectious disease doesn't mean they're healthy if they're starving. WHO starts those discussions in relation to food deficit countries that it is trying to serve. So it is an amazing, amazing, inclusive idea of health, which we today are reaping the benefits of, because, our work-life balance depends on that definition of health. The fact that, we can't work 20 hours a day because we have to look after our well-being. All that for me emanates from some of the discussions that the World Health Organization starts within a very complex UN system. Of course, there was opposition to some of these ideas, but that's the whole point of the WHO. It creates coalitions of peace, coalitions of health, and coalitions of well-being that redefine what it is to be healthy and to be happy and to be safe. And therefore, again, I say, congratulations.
Thank you. Sorry to interrupt, Sanjoy. Let me take that point and come to you, Ruediger, because you speak so well about well-being. And when an organization like WHO speaks about well-being, what does that trigger in terms of action? Talk to us about that.
Yes. And first of all, thank you for the question on the definition. Shall we redefine health as we're 70 years old? And I would say, well, first of all, it might be very personal, but I really cherish the definition of health at WHO because we're not the World Disease Organization. Health is not just merely the absence of disease, but it is social, mental well-being, right? And what does this well-being mean in concrete terms? Well, it means that, number one, I can actually cope with all the different challenges that are posed on me and my family. I can actually receive health care when I need it. I am covered for the major risks in life so that I don't need to feel insecure, or I am not insecure for my life when there's a big crisis like unemployment or so. So it also means, of course, that we're looking that, in governments, that governments make healthy choices the easy ones. I mean, that's been a slogan of WHO for many, many years. And some people can't hear it anymore because we were talking so much about it. But what does it mean concretely? It means, for instance, can you imagine that some countries still subsidize tobacco growth? Right? in Europe, even in Switzerland. So they give subsidies for tobacco. That must stop. You know how much subsidies are given for fossil fuels. We know how much it harms the environment. But there's $6 trillion being spent on subsidizing fossil energy. That must stop. And so there's harsh decisions, yes, to be taken, but when we're talking about health for all and the definition of health, and when I was talking about health as a seismograph, as a compass for development, I'm of course talking about very concrete things that we need to get the economy right. So that means that we need to subsidize healthy products. And they can be so prosperous. Just see how prosperous it is to now look at renewable energies. It's prosperous in economic terms and it's good for the environment. So we have that on so many fronts that we could subsidize the healthy products and services. We need to invest in healthy services. We need to divest from tobacco. Can you imagine that countries still invest pension schemes, shares in tobacco? So, you need to have a sort of capital in pension schemes, obviously. So to make that money work and grow, those people looking after it, many of them invest in tobacco shares. That needs to be divested because, as Sanjoy said, it's illegal. It's against the Framework Convention on Tobacco Control, and that's a hard law. It's not a soft law. It's not just a recommendation. No, it's hard law.
It was the first public health treaty that we brought into
exactly.
that the world came
exactly
together
the
on.
First treaty, and most of the countries have endorsed it, and
Right.
and that means they need to follow that hard law. And many people, I'm not saying that they do it consciously, but they're perhaps not aware that it's illegal to, as a public fund, to invest in tobacco. So they need to disinvest from tobacco and they need to invest in healthy choices.
I'm seeing a lot of questions from our audiences asking us, what does WHO do to enforce this at national levels, and how, when there is a lack of political will? We are running out of time, but just to give you an example of WHO FCTC and its impact, more than 5.8 billion people are now covered by one or the other of the provisions which protect them from tobacco.
Yeah.
That's a big part of the world that is covered and protected from tobacco, and the countries of the world came together to do that, right? So,
first of all, I'm so grateful to the FCTC Secretariat, my colleagues and friends here in WHO who run the Secretariat of the FCTC. But I'm also so grateful to my team in tobacco control, because indeed, by number one, making awareness-raising efforts so that member states know they are not bad conscious, or they're not doing this on purpose. But many don't know. So we need to raise that awareness. We then need to get the data right? So, and the data shows very clearly that more and more countries are quite on track with the FCTC requirements. And then, of course, we need to regulate. We need to be very clear where you can buy tobacco, where you cannot, at what age you can buy it and when not. And of course we need to raise taxes, right? So to make it the price that it needs to have. So for instance, to give you an example, a pack of 19 cigarettes would need in Europe to cost 23 euros, right? In order to actually also to have a polluter pay principle, to actually cover the costs that it creates for healthcare, for absenteeism, and all the side costs that it takes if you smoke cigarettes. So that these are the things that we're discussing then with member states. We're working with our partners, civil society groups, which are so important, you know, in order to hold the flag and really fight with us on that front.
Thank you, Ruediger. I'm going to, because we're running out of time, I'm going to, and I know how passionate WHO is about WHO and our partners are
Yes,
about
we are.
the Framework Convention on Tobacco. So we're going to find another opportunity to go
Very
into
well.
it and talk about it. But I want to just quickly read the list of countries from where our audiences are tuning in: Egypt, Nigeria, Ukraine, Oman, Iran, Pakistan, Kenya, India, Chad, Bangladesh, Mauritania, Trinidad and Tobago, Indonesia, Germany, Zambia, Ivory Coast, Norway, Morocco, UK, Ethiopia, Burkina Faso, Sri Lanka, Niger, Peru, USA, Brazil, Turkey, Lebanon, Sudan, Rwanda, Canada, Spain, Uganda, Papua New Guinea, Greece, Yemen, the Netherlands, Argentina, Italy, Nepal, Ghana, Lesotho, and Guyana. Thank you very much, everybody, for tuning in. And thank you to you, Sanjoy. Thank you to you, Ruediger. This is WHO's 75th anniversary week. But more important than this past 75 years is the work that lies ahead for all of us in the next 75 years. So happy birthday to WHO, to your and thank you for being part of your WHO. Bye-bye.
Yeah.